Well, it is Prostate Cancer Awareness Month, and that's what we're talking about today in our Ask the Doctor segment. I'm joined by Dr. Tom Holley from Urology Centers of Alabama. If you have a question, go ahead and be calling us. Here's the number, 741-9272. Just to get us started,
yes,
Doctor, what is it? With all cancers, it's important to get screening, but particularly with prostate cancer.
Because most prostate cancers do not cause symptoms, and so they're picked up by and detected by screenings, and it's a very prevalent cancer in men, and 1 in 6 men will develop it in their lifetime. And again, they won't have symptoms, and it can be caught early by either physical exam or a serum blood test, which we recommend starting at the age of 40, doing that annually.
Okay, so get that screening.
Yes, ma'am.
You gotta get
yes,
it.
ma'am.
We already have a caller,
Great.
Robert from Fairfield. Robert, what's your question?
Yes, I want to know, as the doctor, I already had the treatment for prostate cancer. It's been about 2 years, but I'm still having hot sweats and sweating. How do I stop that?
So what he's describing is men that are treated for prostate cancer can be given a treatment that causes sweating, and so there are medications you can be put on or switch to another treatment for his prostate cancer that causes the hot flashes. But generally that is with men that have advanced prostate cancer, which means it is spread outside of the prostate, and then we give them a systemic treatment that reduces their level of testosterone, and so with the lower production of testosterone they have hot flashes.
Okay, so his answer is?
His answer is to have a discussion with his treating physician, and there are treatments available, or if the treatments don't work and the hot flashes are bothersome enough, you can switch to a different type of treatment for his prostate cancer.
Okay. All right, Robert, thanks for your question. We have another caller, Jay. Jay, what is your question?
I've had prostate cancer before, and I'm getting up in age. I have the test every 3 years. I will be like 81 the next time I'm supposed to have a test. Is there some time that I can stop having the test? 81-year-old man is kind of a long time to be still taking tests for it.
Yes, sir. So the general rules of screening apply. The AUA recommends, the American Urological Association recommends that you stop screening at age 75, but a lot of that has to be done after a discussion with a patient. At age 81, if you have no diagnosis of prostate cancer, I would definitely have that discussion with patients about stopping screening for prostate cancer. But if you have had prostate cancer and you had treatment in the past and are still being followed, I still recommend to men in their 80s just continue regular follow-up with their treating physician and make sure they're getting their blood test and making sure they don't have a late recurrence of their cancer.
If a man lives long enough,
yes, ma'am,
chances are they will have prostate cancer.
Yes, ma'am, that's
right?
correct. That is correct.
But at some point, up in age?
Yeah, yes, ma'am. So like the official recommendations are for screening is for age. If you go by the Cancer Network Society, they go from 55 to 70. The AUA recommends 40 to 75. And I think it's important to get the younger men in, even though they're not recommended, just to at least get a baseline PSA, because the earlier we find this cancer, the more effective the treatments are, and you can potentially be cured and not have to deal with some of the side effects and sequelae like we heard about from the first caller for treatment. One
more caller, Dean. Dean, what is your question? Dean, do we still have Dean on the line?
Yes.
Dean, go ahead. What is your question about prostate cancer?
I had prostate cancer in 04, and in 07 I went on the Lupron shots.
Yes, sir.
And I stayed on those till last year. My doctor retired. My new doctor has kept me off of them for the last year. And my PSA has gone up to about 2.6.
Yes, sir.
I thought when it got to 2 that he was going to put me back on the shots, but he hasn't. I just wonder if that's a good idea.
Yes, sir. So what he's describing is when your prostate cancer has gotten outside of your prostate, or your PSA, which is the blood test tumor marker for prostate cancer, is starting to rise after your initial treatment, we give you a hormonal treatment, which is the systemic treatment I was describing. And there are two schools of thought on how you should give the treatment because the cancer will only remain sensitive for a period of time, and there are some theories that by spacing out the treatments, it's generally a shot that is given every 3 months or every 6 months. And if we start to skip a few shots, then it may allow the treatment to last longer, and that's possibly why your treating physician is holding off on giving a shot. A PSA of 2 with a prostate cancer history may not be significant in this patient's case, and everybody has to be treated on their own individual basis, obviously, but sometimes I'll allow my patient's PSA to drift up and then give them a shot and then just watch it for a period of time to see how they respond. And it just potentially allows for that treatment to last longer.
All right. And as with everything, check with your own doctor.
Absolutely. Yes, ma'am. Yes, ma'am.
Dr. Holley, thanks for being with us.
No problem. Thank you.
We appreciate it. We'll be right back.